But please, out of respect for folks that will be presenting and speaking here, please keep your mobile phones either on silent or vibration mode. Otherwise, we're going to have to break into a dance when your ringtone goes off. And try to minimize your movement during the presentations. If you need to go out of the room, if you can please wait until someone has finished their section, that would be really appreciated. We have emergency exits, and hopefully you see them both behind us. And the translation services are available. So for this session, you are probably not going to need them if you are, fluent in English. But if you'd like to listen in other languages, we do have that option. You're welcome to go get that if you don't have it already. And we will be trying to keep up with the time that we have for this session. We're starting about 10 minutes late, so we will maybe take 5 extra minutes if we need to, but our goal will be to finish on time so you can go to the next event you are planning to be at. So formally now, welcome everyone. My name is Pallavi Pant, and I work at the Health Effects Institute. And I'm really excited to be here today at the conference, and especially at this session, which is going to be focusing on non-communicable diseases and air pollution. And I think already this morning we've had a very fantastic setting of the scene for us. And this room will need no introduction or reminders about, the stark impact that air pollution has on all of us. And we, continue to hear 7 million deaths, which is a really important number, 8 million, 9 maybe if you look at a particular analysis, but many millions of deaths. But what is equally important and doesn't always rise to the top in our conversations is the fact that there are many more millions of healthy years of life that are being lost, either because a person is living with a non communicable disease and is not able to go to work, is not able to afford medication, or because somebody else needs to take care of them and is not able to work, is not able to have a good quality of life. So it really is a huge impact that is felt not just by the individuals, but the community around them, the healthcare systems that may be, treating them and providing them healthcare support. Also, as a global population, we are aging. And if we have heard anything so far, air pollution really has an impact on the entire life course. So, all the way from pregnancy and perhaps even before to when we get old and die, we are going to potentially experience these impacts of air pollution. And as our populations get older, the chances are that their susceptibility to getting these non communicable chronic diseases, some of which can only be managed and never be treated fully. So we'll spend the session talking a little bit about what those non-communicable diseases are. They range from respiratory diseases to cardiovascular diseases to cancers to metabolic diseases like diabetes. And we're hoping that our excellent set of speakers here can talk about the impacts, what we can do to move on. And we also want to take a few minutes to talk about the emerging set of health outcomes that we know are critically important, including brain health and mental health impacts. So I'm very excited to welcome our first speaker. We're going to have a very dynamic session. We'll do a few talks, we'll do a quick cafe style conversation, and then a panel. And we will have opportunity for you to ask questions. So please note them down as you go along. And now I would like to welcome Dr. Mark Miller, who's a reader at the University of Edinburgh and also the outgoing chair of the World Heart Federation Air Pollution and Climate Change Expert Group. So, Mark, the floor is yours, and you have about 7 minutes.
Goodness, 7 minutes was such a big topic. Hey, if anyone knows me, the chances of me sticking to that are pretty small. First of all, thank you very much to the World Health Organization for inviting me to be here today to talk about this topic as well. Thank you to our hosts in Colombia, my first time in Colombia. What an amazing city. Thank you all to everyone as well. This is the post-lunch session, so this is the difficult session where we all feel a bit sleepy. So what better than non-communicable diseases to keep us all awake? So we've heard a lot about air pollution and how it affects health and well-being today. And most of the speakers you've heard from today will say it a lot more eloquently than I can as well. Um, but we need to take this seriously. Non-communicable diseases, sorry, I've managed to pick up the wrong notes. Can you just give me 1 second? We would describe that in Scotland as a schoolboy error. Okay, so we've heard a lot about air pollution and health and well-being as well. And we've heard these staggering figures that we have for morbidity and mortality. And it's clearly one of the reasons for this, and there are many reasons for this, is not just that we're all exposed to air pollution, not just that it affects everybody, but it affects non-communicable diseases. We have to remember that non-communicable diseases are the world's biggest killer, and that's the case in almost every single country. And without change, that is going to be the case in every single country. So tackling NCDs has to be one of the greatest priorities for the world, no matter what sector of life that you're in. So over the last 2 decades, though, we're starting to become aware that air pollution is not just a problem for the lungs. We've become aware, and it's quite well established now, the scientific evidence is strong, that air pollution affects the cardiovascular system. It affects the heart, the circulation, and the blood. And the importance of this can't really be stressed enough. Cardiovascular conditions are so extremely common in every region of the world, and they remain the world's biggest killer. More than 20 million deaths every single year are due to cardiovascular diseases. Now, any risk factor for cardiovascular disease will therefore be accompanied by significant levels of death and disease, and this is most certainly the case for air pollution. And indeed, if you look at the statistics, 50 to 70% of the deaths that are linked to air pollution are due to cardiovascular causes. And it's this I want to talk about today. So last year, the World Heart Federation, who I'm representing today, dedicated its flagship report, its World Heart Report 2024, to the cardiovascular effects of air pollution. And I really want to just highlight some of the key figures from there. So essentially, we took WHO data. We took the most up-to-date data at the time, which was from 2019, and we focused particularly on fine particulate matter, so PM2.5. So let me give you some of the findings that we gleaned from this reassessment. So PM2.5 levels overall, they're falling. We have some cause for optimism, but we have cause for pessimism as well. Between 2010 and 2019, we actually only saw a 1% fall in PM2.5. And while some regions of the world, like Europe and the Americas, are doing quite well, they're decreasing levels of PM2.5 quite fast, many other regions we're still seeing increasing levels. And particularly in several regions, we're seeing really extreme levels. We're seeing levels that are 10 times the World Health Organization guidelines. And what we have to bear in mind is that those are the regions that tend to have the least resilience to air pollution, the higher levels of disease, the higher risk factors, the less ability to tackle air pollution. But as I said, we have got some cause for optimism. So with the falling PM2.5 levels, there's actually falling rates of cardiovascular disease. The rates of ischemic heart disease and stroke are indeed falling. But as it's just been mentioned in the introduction, we have a growing population, an aging population. And so if you look at the actual numbers of cardiovascular disease, they're actually still on the rise, even though we are starting to see improvements in air pollution. And to give you the headline figures for this report, based on 2019, just a single air pollutant, PM2.5, is associated with 1.9 million cases of ischemic heart disease and 900,000 cases of stroke. These are absolutely staggering figures, and I've been doing this for 20 years now, and I'm still staggered by them. This is almost 3 million deaths from cardiovascular disease just from a single air pollutant, year on year on year. It should be declared a public health emergency. But NCDs, we have to remember that it's not just about mortality. Mortality is great. It's great for advocating for change. But this is about morbidity as well. And cardiovascular diseases are a huge source of ill health, debilitating health, for the people who have it and for their families. And as part of this review, we looked at other cardiovascular diseases. We looked at the morbidity. And it's not just mortality that's linked to PM2.5. It's almost every major cardiovascular condition, heart failure, aneurysms, irregular heartbeats, all these conditions. And they're all made worse by air pollution and many different air pollutants. We always focus on PM2.5, but make no mistakes. The gases that come from vehicles, for example, NO2, ozone, sulfur dioxide, they're all linked to major cardiovascular conditions. Now, I've only got limited time today to talk about what's in the report, so I just want to highlight some of the key facts. Please go online and download it. I should have a web address, but I'm an old man now, so I can't put a QR code on a slide. Search for World Heart Report 2024 or air pollution, you will find it. But just let me tell you about some of the things that we mention in it. We're not just talking about outdoor air pollution. We're talking about indoor air pollution. And indoor air pollution in 2019 was linked to 1.7 million cases of cardiovascular conditions. And of course, this comes from solid fuel burning. And as the world changes and we more develop, I think we'll start to see this not only in low and middle income countries, but also in high income countries as well. But right now, if you look at indoor air pollution and you want a case for inequalities in the world, look at solid fuel burning in low and middle income countries. We highlight the interactions with other risk factors. So there is the interactions with climate change, and other speakers have mentioned those as well. Don't forget the other risk factors: high blood pressure, smoking, low physical activity. The complex lives that we lead, all these risk factors are interlinked, and we see synergistic effects. The benefit of that is, of course, that if we improve one of these risk factors, we may help offset some of the others. We highlight in the report the greater need of monitoring of air pollution, particularly in many countries. Africa, we highlight in particular. We need to be able to monitor air pollution. We already know a lot about air pollution, but we need this information. It's what allows us to regulate air pollution. It's what allows us to test how successful these interventions are. And this is really important because, as we highlight in the report, less than 64% of the countries in the world have legally empowered policies that will let them tackle air pollution. And this has to change. I'm not painting a cheerful picture, but there are success stories. Please go to the report. We will see the countries around the world where they improve their air quality through both small and large policies, through urban design change for access to green space, traffic regulations, encouraging active travel, transition to clean fuels, and of course awareness and education, as we're doing today. The report also makes a number of key recommendations. It makes 10 recommendations overall. I will highlight just 2. One of them is that we do need to reach the WHO guidelines for air pollutants. The key reason for that is these are based on health. If we want to get the maximum health benefits from environment, that is why we need to reach the WHO guidelines. And that is going to be a challenge. Some countries are going to struggle to do that, but the ambition is needed. We absolutely must do this. So please, countries, instead of just saying, we need you to hit these air pollution targets now, take that further, develop a roadmap that you can implement to get there as quickly as possible. And the other thing to mention is fossil fuels. Of course, the conference and the reception that I certainly enjoyed last night was hosted by the Fossil Fuel Non-Proliferation Treaty. This is hugely important. We need to be looking to the future now. Air pollution mixture is changing. We have new air pollutants. But what we know right now is that fossil fuels are the greatest source of air pollution, not only for climate change, but the ones that affect health. These are the sources of the ultrafine particles that penetrate deep into our lungs, into our blood, and reach every organ of the body. But we also need to do more. We need education. We need to be speaking about air pollution and medical training. I work closely with cardiologists. I now teach some of the junior doctors on air pollution. This didn't happen before last year. That also has to change. We need to be able to raise public awareness, and that will lead to changes in policy. And I won't just finish on that word policy. Policy is important. There's lots of changes that can be made, but if we want to have the biggest impact, we need those political commitments. And this is just not a negative thing. This is not just saying trade off with economy. There is an opportunity here. All these terrible figures about how much in the way of cardiovascular disease is linked to air pollution, it's also an opportunity. If you can effectively tackle air pollution, you will also come with that, you will assuredly see the benefits, and we will help improve heart disease and the many other conditions that are linked to it. Thank you.
Thank you very much, Mark. And I would once again really encourage you to check out the report. It has a lot of wonderful resources that you can use to take this message to broader communities within your countries and regions. And from heart health to lung health, I would like to invite Dr. Sunkar Ture to talk a little bit about chronic respiratory diseases, what happens when we take a breath, um, and his experience working with healthcare sector in the Gambia. So welcome, Sunkar. Really glad you could join us today.
Thank you very much. It's an honor to be here today. I don't have any slides, so I'm just going to tell stories because I think it's a good way to tell what I do. I'm a pulmonologist by training, originally from the Gambia, and I started doing work in air pollution when I went back home and started seeing young women who've never smoked with terrible lungs, and they didn't have TB. And as a pulmonologist, I started wondering, well, what's going on? It must be something they're inhaling. And the human lungs are designed to inhale nothing but clean air. It's such an important organ. It's a window to your body. And if you don't know how important breathing is, try holding your breath for a minute. And at the end of the 6-second mark, that sensation you have is the anguish that people with diseased lungs have. It's the anguish that people with breathing polluted air experience. And so I asked the question, well, what's in the air in Gambia? In the United States, if I know your residential address, I can tell you the air quality in your residential area. And I tried to find that information in Gambia, and there was nothing. I got very frustrated at the bedside. And so I took that anger and started buying low-cost sensors and installed them all across the Gambia. And today I'm proud to say that we have air quality sensors in every region in Gambia. We have about 27 low-cost sensors and a reference grid monitor. But that's not why I'm here. I'm here as a pulmonologist to talk about, well, what does it do to your lungs when you breathe diseased air? Fine particulate matter is able to penetrate deep into your body, into your bloodstream, and it causes inflammation all through the way in your upper airways, in allergies, and can cause bronchitis or a cough. So a lot of times when patients have a cough, they think, well, I think I have a pneumonia, so then take an antibiotic. But it's actually not really a pneumonia, you just have a bronchitis from breathing poor air quality, right? And those are some of the short-term consequences. Bad air quality also increases the risk of having pneumonias per se, because it affects the way that your lungs fights infections. Your lung has a good vacuum system that helps you clear up your airways, and that clearance mechanism is impaired when you're exposed to very polluted air. And we find that in many parts of the world where we have, for example, in West Africa, the Harmattan dust season, when we have the dust storms, there's a lot of people that come to see me and go to hospitals with respiratory complaints, right? Many of them may not come to the hospital. So when we talk about the burden of disease, we're not only talking about the number of people who die, but also the people that live with disability, lost economic productivity that stems from days and school days that are missed from schools. Now, people with asthma and COPD are especially vulnerable because they have diseased lungs to begin with. These are people who are also very vulnerable to the short-term effects of air pollution. So when we think about this problem, it's not only in terms of mortality statistics, we have to think about it in terms of the disruption to economic productivity, to living healthy lives, and also to the social well-being of communities that we serve as well. And so in Gambia as well, we've had issues with cardiovascular disease. You would not believe it. In the EFSTH, and that's a teaching hospital in Gambia, stroke is the #1 cause of death among adults. Stroke. And we know there's a strong relationship between stroke and PM2.5. and air pollution. Most of the smoking rates among Gambian women is 0.3%. Smoking rates among men is 11%. So it's not just tobacco, it's something else. It's the big 5 risk factors. Many medical students will tell you unhealthy diet, alcohol, the other 4, but air pollution seems to be the one that they tend to not know much about. So I think as a medical professional, we have a responsibility to raise awareness as advocates to raise in this area. Then again, there's also the long-term consequences, right? We talked about strokes and heart attacks and asthma exacerbations, COPD exacerbations. What happens if when you're pregnant, you're breathing polluted air? Now, pregnancy does certain things to your breathing. You breathe faster and deeper. So you're actually inhaling more polluted air than non-pregnant women. Children have faster respiratory rates than adults. So for their body weight, they're inhaling more. That explains, in part, why they're especially vulnerable to the harmful effects of air pollution. And you think about the unborn baby. So we now know from the evidence that indicates that the harmful effects of air pollution is not only when you're born, but it starts in utero, when your lungs are developing in your mother's womb. So you think about how our mothers and our sisters are cooking with firewood in a congested environment. They're already setting up that unborn baby for a lifetime of diseased lungs and impaired lung function development. So it's really a big issue. So when you think about vulnerable population, it's not just human adults and children, but also unborn babies as well, right? And then that exposure continues throughout life. It's interesting to note, I didn't know this, and I'm a pulmonologist, that PM 2.5 has been listed as a Category 1 carcinogen by the IARC since when? At least 2016. What is the classification for tobacco? Class 1. But that connection has not been made among us as healthcare professionals to recognize the carcinogenic potential for that. And lung cancer is a leading cause of cancer death worldwide. And also the second leading cause of cancer death among women globally. So in African countries and other parts of the world, in developing areas, we're seeing increases in NCDs. And I think it's time for us to sound the alarm bells for our policymakers and our politicians to recognize that it's a double whammy, both short-term and long-term. And we naturally start thinking about building health systems that can tackle these problems while fixing the acute issues. And I think a just energy transition is critical. How do we make women and children healthier by moving away to cleaner energy sources at the household level, at least for a start? And then we can move on to transportation and other areas. And so, to my perspective, I think that those are some of the things that we've seen. In Gambia, there's a lack of data. I think between 23 and now, we actually have, for the first time, know what the air quality is like in Gambia. We produced the first air quality report this year that was approved by the Environmental Agency. And now we're beginning to recognize that it's a big problem in our country, but then we're going to need ongoing support to sustain that endeavor so that we can embed and mainstream air pollution in our global pollution management strategy as a national priority. So I think, talking about those things from a health perspective, I tell the stories of my patients that I see at the bedside. To tell someone not to cook, I mean, that's not something I can suggest to them. So we really have to make this as a case of a human rights issue to ensure that people are given options to lead, healthy and dignified lives. It's mostly the poorest of the poor that can't afford clean energy stoves that are going to be exposed to these things. And so maybe some of the socioeconomic determinants that we tend to attribute to low socioeconomic status is really, in a part, related to how we cook and how we use energy at home. And so it's multifactorial. We need to collaborate with people. And I'm just going to stop here and see if y'all have any questions. That's all I can tell. That's the story. I didn't have any slides. I just want to tell my story as a pulmonologist from the smallest country in Africa. Thank you. Thank you.
Thank you very much, Somkuru. That was, both inspiring that you're able to now bring more data and training into the country, but hopefully we also have people in the room and at the conference who can, hear this experience and learn from it and get inspired by it. Since we are on the topic of non-communicable diseases and we've been hearing so many numbers, we heard about 8 million deaths because of air pollution. And according to, the data we have, 7 million of those are linked to NCDs. My grandma died when she was about 50 due to diabetes complications. My other grandma died because of multi-organ issues. She had early onset Parkinson's, and she had lived in Delhi, which is one of the most polluted cities in the world, my whole life. Were those deaths because of air pollution? I don't know. But I know there is a connection between what they were breathing and the diseases that they lived with because they never smoked. And both of them lived at a time where appliances were not common. So they were extremely physically active and ate good diets. So when I start thinking about it and going back, clearly there is a connection, and the brain health and mental health piece of this problem is something that we are just beginning to discover. We don't have as many statistics to point to yet. So I'm very happy that we have two really great speakers here with us, Burchin and Ale, who have been working in this space. And I will maybe start with a very general question to both of you. We know how air pollution impacts NCDs. We've also just heard about it. But in terms of the connections between brain health, mental health, and air pollution, what do we know? And what can we share with this wonderful group?
Thanks, Pallavi, and thanks to WHO for inviting us to speak and for everybody to attend this session. Yes, so great question. And I think maybe before starting, we could just do a very brief distinction between how we're speaking about mental health and brain health in case it's helpful for the audience. But we're using the mental health kind of definition of the WHO definition of mental health as a state of well-being that really goes beyond the absence of mental disorder. But it's about the person's ability to contribute to society, to learn well, to work well, to cope with adversity. And mental health really exists on a continuum. When we are speaking specifically of mental disorders, we tend to mean and refer to clinically significant disturbances in thoughts, feelings, emotions, which also contribute to a degree of psychological distress and lead to impairments in functioning. Mental health disorders tend to be treated under the medical area of psychiatry or clinical psychology, and they include things like mood disorders such as depression or psychotic disorders such as schizophrenia. But we're also going to be covering brain health. I don't know, Preston, whether you want to touch on that.
Thank you, Ale, and thank you again for having us here and giving us the opportunity to be talking about brain health and mental health. And what we mean by brain health in this conversation is anything that pertains to the functions and disorders that are linked to central nervous system, such as cognition, memory, decision-making, sensory motor function, to disorders such as dementia. We had mention of stroke, epilepsy, as well as neurodevelopmental disorders such as autism and ADHD.
Great. And mental health and brain health conditions are often related or interlinked, but for the purpose of this conversation, we're going to treat them as separate entities, given the degree of the evidence on both constructs, but also the potential different pathways through which mental health and brain health are being impacted. So to start with very broadly, there's largely two main ways in which air pollution is currently impacting mental health. The first is by increasing the risk for new mental health problems, and the second way is by worsening mental health in people with pre-existing mental health conditions. So if we look first at the way in which air pollution is increasing the risk of new mental health problems, the strongest evidence that we have at this intersection is on the link between air pollution and depressive symptoms, and also between air pollution and suicide. So that is where we tend to have the most robust evidence in terms of meta-analysis and aggregated data. A big issue in this field is obviously the distinction between correlational evidence and causation. So how do we actually know that the air pollution is contributing causally to the depressive symptoms or to suicide? And there are a couple of studies that actually do a pretty good job at being able to draw causal inferences on the link between air pollution and, for example, suicide. An example is a study that looked at wildfire drift smoke as an exposure that sort of impacts people in a relatively random way, and they were able to use that as a quasi-experimental study design to really assess how areas that were impacted by more wildfire smoke through the drift smoke saw increased rates of suicide, and in particular areas that saw one standard deviation of 13% increase in particulate matter saw a 2% increase in suicide rates. So something that is important to highlight is that these tend often to be relatively small but significant effects. And the fact that they're small, I think, is important to highlight. But when we're considering disasters or events that might be impacting millions of people in a city, a small effect size is still something which obviously can have important consequences on public health systems, for example. Another element that I think is important to highlight is the timing at which the air pollution exposure happens. So we're seeing, for example, increasing evidence around how exposure to air pollution, either in utero or during childbirth, can have impacts on psychopathology in young adolescents or in adulthood. A recent study that used the AVEN longitudinal studies from the UK looked at a sample of 9,000 children and found that exposure to air pollution in utero and at childbirth increased the risk of the person developing schizophrenia and depressive disorders in young adulthood and adolescence. And the second way I mentioned in which air pollution can impact mental health is by negatively impacting mental health in people that are already living with mental health conditions. So for example, in certain situations, it might be seen as increasing the risk of relapse or just worsening their mental health. So again, a really excellent study that used data from the Maudsley, which is a big psychiatric institute in London, looked at people who had just received a diagnosis of mood or psychotic disorders, and they found that those people that were living in higher polluted areas were more likely to use more mental health services, and that was used as an indicator for illness severity or relapse. So in summary, again, air pollution seems to be able to impact mental health both by worsening mental health in people with pre-existing mental health conditions, but also increasing the risk for new mental health problems. The big question, which I'm sure you might be kind of asking yourself, is why? Why do we see these relationships between depression or schizophrenia and air pollution? And the answer to that is that it's complicated. As with most mental health conditions, it's likely to be the result of many interacting mechanisms, either biological, either psychological, at the social level. I know the person is going to touch on the kind of biological elements as well. And somebody also mentioned the impact that air pollution can have on inflammation on kind of any part of the body. But similarly, at the social level, air pollution might mean that people are not able to go outside to use their usual coping mechanisms that they might use to manage their mental health, physical activity, socializing with others. There might be impacts through psychological mechanisms, the impact that air pollution can have on mood, on cognition, on sleep, on emotion regulation, and how all of these factors could in turn impact mental health. I think it's also important to highlight some of the kind of methodological complexities in the mental health and air pollution space, given that it's such a new emerging area. There's obviously issues around how the exposures is measured, and often in the mental health field, we yet have to think a bit more carefully about how do we exactly conceptualize the exposure. Most of the literature tends to look at PM 2.5, but doesn't really disaggregate more in depth than that. There's probably many confounding variables that make this relationship quite complex, and I think these are important things to highlight. And I think I wanted to also finish by highlighting that while for most of the conversation we're going to be speaking about air pollution, the source of air pollution, as in the extraction of fossil fuels, has also been shown to be a potential negative impact on mental health. There was actually a recent study published a couple of weeks ago looking at populations living close to coal mines in Germany, and what they found was that compared to populations that didn't live close to extraction sites of coal, people that lived closer to mine had higher prevalence rates of depression and somatic symptoms. So I think highlighting also the impact that the extraction of fossil fuels as the determinants of air pollution can have on mental health is, I think, also an important point to stress. But Percy, over to you for the brain health.
Thank you so much, Ella. Was such a great summary on the mental health aspect. I'm a neuroscientist. I've been studying different brain disorders. Started with neurodegenerative diseases and moved on to more different kind of neurological disorders. And one of the questions that was really interested for me and any other scientists I work with was always how, when we think about air pollution, we always think about the lung and our hearts because it seems just more easier to think about how it enters our lungs, but it's a little harder. How do the pollutants enter our brains? And we see the pollutants enter our brains into two pathways. One is directly from our nasal cavity. Every time we breathe, there's a direct connection to our olfactory bulb and where it resides in your prefrontal cortex. And so there could be a direct pathway of pollutants entering our brain. And the other pathway is through a more indirect pathway of systemic inflammation that happens in our bodies. When we had great scientists and healthcare professionals talking today about how the lungs get inflamed, our bodies, sometimes even our guts get inflamed from the pollutants that are in our environments. And these pollutants cause inflammatory responses. We call them, there are certain chemical compounds such as cytokines and chemokines that can get into the bloodstream and start going all over our bodies. Now, our brains have this beautiful protective layer that's supposed to be protecting us, anything that comes from outside and including from the blood. But it's not a perfect system. And there are certain individuals, certain populations where this blood-brain barrier is more permeable, such as in children and elderly population, as well as people with existing neurological conditions such as multiple sclerosis and Alzheimer's. We know that the blood-brain barrier becomes more permeable, allowing more pollutants or inflammatory signals to come in. And in our brains, we have these beautiful structures. I'm sorry, I'm a neuroscientist. I think cells and other things are beautiful. We have these non-neuronal cells called microglia. They're kind of like our immune cells in the brain. They don't like things entering and hurting the brain, so they are the protective things. When these pollutants or stress signals come to the brain, they themselves become reactive and they try to protect the brain by themselves releasing these cytokines and chemokines. And when neurons get these signals, they get into a stress response. They start going through oxidative stress. They start going through DNA damage. They start going mitochondrial dysfunction, and that can even lead to neurodegeneration. And these most happen in the areas that are most vulnerable are our cortex, prefrontal cortex, and hippocampus, the areas that are pertaining to cognition, memory, complex tasks such as decision-making, emotional regulation. These parts get the most impacted. So how do these respond to the diseases NCDs and others we've been talking about? Air pollution is considered one of the 14 modifiable risk factors for developing Alzheimer's and other forms of dementia, especially in the elderly population. We see, and not only in the development of it, but also progression. People with even early stage of Alzheimer's, sometimes Parkinson's, can have a really fast progression due to their exposure to air pollution. We have heard from our great colleagues on how it's also increased risk factor for stroke and other cerebrovascular diseases. We know that on the days that air pollution is really high, there's a lot more hospitalizations to happen due to the complexities coming from Alzheimer's and other neurodegenerative diseases, stroke, but also even for epilepsy, for MS, for multiple sclerosis, for migraines. But that's not all. What happens structurally in the brain is that these areas that they're called white matter, which kind of are the parts where the neurons, axons that communicate with one another, starts getting really impaired, and that causes lesions happening in these matter. Basically, the different part of the brain stop talking with themselves, with each other. Sorry. And we also see much more lower amounts of volume of gray matter, where the actual bodies of these neurons reside. So we see actually changes in cognition, in people's ability to do memory tasks, and we can see those even in utero, these structural changes happening. So we had this is no coincidence that children keep on coming in every subject, every health issue we talk about. They are really the most vulnerable, and their brains are the most vulnerable as well, because they're going through a lot of neurodevelopment, especially in utero when babies are exposed to air pollution, they tend to have more, are born earlier and at lower weights, which is really critical gestation period for especially their brain development. And we had the cohort studies that are done by my colleagues starting in 1990s looking at pregnant women and their babies in Harlem, New York, in Krakow, Poland, in Bristol, UK, and they all in these different cohorts saw the same things. These babies were born earlier at lower weights. They had serious neurodevelopmental delays. They were slower to learn to talk, slower to learn to walk. At early childhood, school age, they were more likely to be diagnosed with ADHD and autism. They had lower IQs, and as Ali had mentioned, in early adulthood, in the teenager years, they were more likely to have psychiatric conditions and other psychological conditions such as depression, anxiety, psychosis, and suicide. There are really, what really scares me about this whole scenario that we have to take seriously is this tremendous burden of already neurodegenerative diseases, let's say, or other brain disorders that are happening. I think IHME, the Institute of Health Metrics and Evaluation, had estimated that brain disorders cost about $2 trillion. More or less, this effect is also health costs, but also loss of productivity cost. And the World Alzheimer's Organization had said that by 2050, the amount of people with dementia we would see would triple in numbers. And that was an estimation they did only by looking at the aging population. They just estimated, okay, these many people will be past this age, and this is what the numbers are going to be, which is scary when we think about the whole burden it will have on our society and our economies. But that's a very low estimation, I would say. What we're learning with all the different environmental factors happening with the effect of air pollution, these numbers are going to be more than tripling. And it's not only that, we're going to be seeing these numbers, people getting Alzheimer's, dementia, not at age 70, 80, but at 40, 50. And at their height of productivity when they have young children. And that's something we really have to be thinking about for our predictions. Sorry, that was really long.
No, thank you both. This was really helpful, and I think also begins to illustrate the challenge that we face. But every time I hear about impacts, my immediate question is, yes, there are impacts, and they're very large. So what are we going to do? What are the what are some of the steps that individuals can take? What are the steps that we think policymakers need to be thinking about in order to make progress on this really critical problem?
Shall I go first? Okay. Thanks. Yes, I mean, to date, given that this is an emerging space, the vast majority of the literature has very much focused on quantifying the impacts and understanding the mechanisms underpinning the relationship between air pollution and mental health. We are, however, seeing emerging studies and interventions looking at the potential co-benefits to mental health coming from clean air policies. In particular, one case study that I wanted to highlight comes from China. And again, a recent study in JAMA was published looking at how China's clean air policies were associated with suicide rates across the country. And they used an interesting study design by which they were able to look at the relationship between air pollution levels and suicide by using thermal inversions as a way of really zooming in on air pollution as the exposure. And what they found was that, as I mentioned before, they saw a positive association between higher levels of air pollution and higher suicide rates. But what they did then is that they modeled how the recent Chinese clean air policies led to changes in suicide rates. And what they found was that in only 5 years, the interventions aimed at clean air policies were responsible for a reduction in around 46,000 suicides, which had been prevented thanks to these clean air policies. And again, China's suicide prevalence rate was already declining, and they estimated that the air pollution policies were responsible for around 10% of that decline, which if you think about in the context of suicide prevention strategies, that is really quite a significant contribution to the decline that the country was already observing. I think another thing that I wanted to highlight in the context of co-benefits is also the clear link between mitigation and a number of mental health co-benefits. So whether you're thinking about physical activity as a result of more active modes of transport, whether you're looking at increased access to green and blue spaces, those are all interventions that have clear mitigation implications, but also have a very robust evidence of having important co-benefits for the mental health of individuals and communities. I wanted to just use one example from Ireland. So the Irish government recently rolled out a plan called the Warmth and Wellbeing Intervention, in which they identified houses that were experiencing energy poverty, but also in which people with chronic respiratory conditions were living. They provided energy update to the houses of these people and families. And what they found was that understandably, these houses became more sustainable, energy was more accessible, the respiratory symptoms improved, but they also measured mental health. And what they found was that they saw decreases in symptoms of anxiety, in symptoms of depression, and improvements in general quality of life and psychological well-being. So again, this highlights the important co-benefits that interventions aimed at, again, mitigation can have on mental health.
Yeah, thank you, Pallavi, for this question. It's such a special question dear to my heart that made me get out of the lab and be doing something with the knowledge. As a scientist, what we try to do is we try to expand our understanding, expand our knowledge, but knowledge without action is worthless. What's really powerful about the audience we have here in this convention is the power of action and change making in this group. But action by itself, without being backed by knowledge and evidence, could be wasteful. To be most impactful is that we have to work together. So please take it as an invitation to work together. I lead we both work in different global networks that are part of really these multidisciplinary working together, scientists, clinicians, policymakers, even working together, try to understand, but also address the effects of air pollution and other environmental factors and climate change impacts on mental health and brain health. And please connect with us. Please connect us with your researchers and scientists so we can expand our understanding, so we can really look at solutions together. Please connect us with your healthcare professionals, because we can learn together from each other, and we wanna help train them to be more prepared for these events that happen when air pollution is really high or there are some climate emergencies happening. Please connect us with your policymakers so we can share all our data, everything we have, so we can turn it into action. And please connect us with your most vulnerable communities. We want to learn from them. We want to listen to them, and we want to work with them to make them more resilient. One of the things I can say from all the experiments I have done in my 20 years of studying brain health is that our brains are really resilient. They are very strong. And given the opportunity and there's a point of what we call point of no return. But until we reach that point of no return, we can really make our brains stronger and reverse the damage that's done to them with the beautiful neuroplasticity that we have, where we can rewire our brains. So please, let's work together before our brains get to a point of no return.
Thank you so much, Ale and Burchen. This was great. And please find them if you're interested in learning more about brain and mental health. We're going to move on now to the next segment of the session. Thank you both. So as I move on to the next segment of the session, I really want to thank Marit and Samantha, who I think are in here, both from WHO, who really were the people that put the whole panel together with inputs from the NCD department, as well as the Department of Brain Health, Mental Health, and Substance Abuse. So a big thank you to them for, shining a light on this particular topic. We also have a video message from the head or the director of the NCD department, Guy Fonso. We'll play that for all of you.
Dear honorable ministers, mayors, colleagues, and friends, thank you for the invitation to speak at this important and very timely conference. I sincerely regret that I could not join you in the beautiful city of Cartagena due to other commitments. In this session, we will discuss one of the most critical yet often overlooked risk factors for non-communicable diseases, NCDs. This is air pollution. In my view, air pollution deserves to climb higher on the international NCD agenda and receive much more attention. The death toll is enormous, and there is great potential for preventing these diseases, deaths, and related costs. The timing could not be more opportune as we are approaching the 4th United Nations high-level meeting on NCDs, which will take place in New York City in September. Let's examine some facts about the impacts of air pollution on NCDs. Air pollution affects almost every organ and system in the body, leading to more than 7 million annual deaths. A staggering 83% of these deaths are due to non-communicable diseases, primarily ischemic heart disease, stroke, lung cancer, and chronic obstructive pulmonary disease, COPD. This makes air pollution the second leading risk factor for NCD deaths globally after tobacco. Some studies and global reports have even found that air pollution is the #1 risk factor. People living with NCDs are especially susceptible to polluted air and are at increased risk of severe illness and premature death. We need greater awareness of this issue and strategies to protect people living with NCDs when air quality is particularly poor. The impact of poor air quality extends beyond these diseases. It increases the risk of asthma, diabetes, low birth weight, premature birth, stillbirth, and miscarriage, as well as neurological conditions like cognitive impairment and dementia. It needs to be noted that these conditions are not yet included in the estimates of air pollution-related death by WHO. Air pollution exposure is particularly dangerous for children and can lead to NCDs later in life, such as impaired lung growth and development resulting in asthma and COPD. This conference is imperative because it not only presents evidence on the health risks of polluted air, including on NCDs, but also offers solutions to improve air quality and demands action by national and city governments, the private sector, and world leaders. It is clear that donors need to step up as the costs of air pollution for health and society are extremely high. Millions of people are affected by NCDs due to the dirty air at any time, from young children, teenagers, adults, all the way to elderly populations. These non-communicable diseases are often chronic with huge economic impacts. People affected may not be able to work or to go to school, and they may be hospitalized for long periods, resulting in a vast burden on the health system. Hence, the health sector is crucial and should play a leading role in the fight against polluted air. This requires that the health sector is aware of air pollution's impact on NCDs, both short and long term, and be prepared to protect people living with NCDs when pollution levels are high. Training health and care workers and including air pollution and health curricula are of great importance. This is something we in the NCD department will promote and support. Most importantly, a main objective of the conference is to ensure countries, cities, and key stakeholders, including the private sector, commit to halving the health impacts of air pollution by 2040 compared to 2015. Achieving this target would mean a few million fewer NCD deaths, a significant win. I mentioned the UN high-level meeting in September on the prevention and control of NCDs. This is an opportunity to ensure that air pollution is firmly established as a risk factor on the agenda and in the political declaration itself. If we work together, as we are doing during this conference, I am confident that member states will include this global target in the key recommendations of that political declaration. Additionally, having air pollution policies and measures included among the NCD best buys is another crucial objective. To conclude, the NCD department stands with the health community in urging world leaders to combat air pollution as a key NCD risk factor. We see a tremendous opportunity to prevent millions of NCD deaths in the next decade if countries and city governments, along with the private sector, reinforce their efforts to clean the air in line with the suggested target of a 50% reduction, or even further. There's a clear need to increase awareness among member states, many of whom are not fully aware of the massive impact of air pollution on NCDs. I wish you all the best of luck and a great continuation of the conference. Thank you.
Fantastic. So now we've heard a lot in the last several minutes about the ways that air pollution impacts our health, the impact on NCDs, and it is also true at the same time that countries are actively trying to deal with this issue. So we are very pleased that Janet Fortunata Lopez Santiago is able to join us. She's the Director of Epidemiological Surveillance of Non-Communicable Diseases at the General Directorate of Epidemiology in Mexico, and she will share her experience with us. Welcome.
Good afternoon, everyone. I prefer the presentation to is in Spanish. Sorry. You are in Latin America. Ok, gracias. Bien, primero, justo estoy agradecida por escuchar en estos días, ayer en la preconferencia y ahora el día de hoy con lo que nos acaban de señalar. Y creo que ese salto desde la investigación y lo que se ha encontrado en relación con los efectos en la salud, en enfermedades no transmisibles, es lo que nosotros traducimos en una acción en salud pública. Y esa traducción lleva a la construcción en el país, en México, que contamos con muchos investigadores realizando justamente estas investigaciones crudas que nos dejan cuáles son los impactos, pero que no tenemos una medición en México. Han habido, aunque el país es muy grande, pero no hay un sistema de vigilancia que haga eso a nivel federal. Hay experiencias locales muy pequeñas en ciudades, pero lo que se necesita es ver la magnitud del problema, y eso no lo vamos a lograr si no construimos el sistema. Y justo planteamos un sistema integral con una visión que incluye dentro de este sistema el componente de agua, de aire, inorgánicos, que plantea metales pesados, plantea hidrocarburos, plantea agroquímicos, entre otros. Y seleccionamos entidades que ya hemos detectado a través de investigaciones, que ya nos dijeron los investigadores, oigan, aquí está un problema. Que justamente nos dimos a la tarea, y es algo que del acompañamiento del Instituto Nacional de Salud Pública como centro colaborador de la OPS en materia de salud ambiental, nos dimos a la tarea de juntar a todos los actores en la mesa y hablarnos. Juntamos al área de ambiental, juntamos a los académicos, juntamos a quien justo tiene la información en la mano, que ha generado desde los institutos de enfermedades respiratorias en México, pero no nada más de la Secretaría. En México tenemos muchas instituciones que hacen atención a salud. Entonces llamamos a Seguridad Social, a las Fuerzas Armadas, a todos en una sola mesa. Y les dijimos, oigan, tenemos que trabajar juntos. Ustedes díganos qué es lo que ustedes ya tienen de evidencia y que debemos de poner en el sistema. Entonces, eso creo que justo porque no ha sido una tarea de uno solo. Justo ahí en la mesa nos quedó claro, y creo que ese es el gran acierto que hemos tenido desde que comenzamos esto, y les estoy hablando de que llevamos a prácticamente 3 meses, que hemos visto un arranque bastante bueno porque hay voluntad política, y hay que decirlo que en México tenemos una presidenta, es la primera mujer que gobierna en el país, y tiene una formación ambiental. Ella fue secretaria de Medio Ambiente, entonces conoce el problema. Para nosotros eso es llamar tierra fértil política, porque se une la coyuntura de la política justo con la necesidad técnica. Entonces lo que hicimos fue darnos a la tarea. No inventamos, como decimos allá, el hilo negro, sino ya tenemos experiencias que ya hablaban de un sistema de contaminación ambiental atmosférica, teníamos datos, teníamos justamente este monitoreo que ya se realiza, y lo que hicimos fue diseñar este sistema, tomando los datos que ya existen, ¿no? Los contaminantes, criterios, y los vamos a colocar en un mismo sistema. Estos contaminantes con las enfermedades que son las que ya discutimos aquí, ¿no? Y estos son los que estamos viendo ahorita. Nosotros justo es lo que nos da la evidencia científica ya generada. No estamos difiriendo, yo aquí justo lo he escuchado con ustedes. que tenemos la parte de las enfermedades respiratorias, como el asma, como la hipertensión arterial, justamente otros como infecciones respiratorias agudas, otitis medias, pero también las enfermedades cerebrovasculares, las isquémicas del corazón, ¿no? Pero también justo fue la discusión de cómo vamos a poder abarcar todo esta gran, que ya nos dieron un listado de cuáles son los efectos, y justo lo pusimos por fases, como decimos y como vemos un embarazo, ¿no? Hay que esperar, hay que cocinar al bebé, esperar que gatee el bebé, después que camine y después que corra. Así es lo que queremos lograr con el sistema. En este momento hay que arrancar, pero arrancar con lo que ya dice la evidencia, con lo que podemos ya obtener, porque va a evolucionar también de acuerdo a las capacidades desarrolladas de cada país. Pero yo sí justo invitaría a los países a que sí se puede con lo que se tiene, solo hay que tener voluntad. Entonces, justo quiero como unir esta parte de la evidencia que se genera y cómo es el paso siguiente hacia una política en salud pública, que es la experiencia que yo les pudiera compartir. En este momento, tenemos seleccionadas en el país más de 50 unidades monitoras de calidad del aire que van a entrar en este sistema. Y con este radio tenemos más de 300 unidades médicas potenciales de integrar al sistema de vigilancia, de un total de 1,300. O sea que estamos hablando de un universo de población bastante interesante. Solamente en la zona metropolitana tenemos casi al 30% de la población de todo México. Hablamos de 41 millones de personas en esta zona. Entonces, ya sabrán la exposición que tenemos en esta zona de México, de la Ciudad de México, por la problemática que atravesamos. Entonces, esperamos en una próxima tercera conferencia mostrarles ya la evidencia con la que contamos, ¿no? Gracias.
Muchas gracias, Janet. That was very inspiring. And it's wonderful to see that there are all these examples of surveillance systems of bringing people together. We've been hearing about silos, all morning today. And I'm very heartened to see there's already efforts happening in so many places to bring people together, to gather the data, to make informed actions. We're now going to move to our final segment of the session. We've heard about air pollution, we've heard about the impacts on health, and we want to take sort of a more pragmatic look at this point. What are we going to do? What are we already doing? And what are the next steps as we go back to our homes from Cartagena? So I would now like to welcome our panelists. Roland Law, is he in the room? Ronald, sorry, not Roland. Jose Luis Castro, who's the WHO Special Envoy for Chronic Respiratory Disease. Really fantastic that you could join us. Welcome. And Katie Dane, NCD Alliance. Welcome. We've already heard from her this morning, so looking forward to more insights. We're going to give a minute to Ronald, I'm sorry. And then we will get started. But while we're waiting for our panelist, I wanted to highlight a couple of things. You heard from Fortune and from Ale about brain and mental health, similar to the World Heart Federation report on heart health. The United, I'm going to not say it without looking at the correct name. United for Global Mental Health Network has a brief on air pollution and mental health, which summarizes and gives references to a lot of the studies that Ale mentioned. So if you're interested in learning more, please check that out. Also, I'm going to do a quick pitch to those of you in the room who are interested in the burden of disease data. We're currently working on the next State of Global Air report, which will be out in August, and we're going to be focusing on non-communicable diseases in that report. So if you are interested in brainstorming with us, contributing to it, bringing case studies, examples, please contact us. We would love to have you join us in developing that report together. And I will probably get started now. Hopefully, Ronald can be here with you. Thank you so much. all of the, all of the talk on is centered on the idea that we want to save people's lives and improve the quality of life. How can we do that, knowing the connections between air pollution exposures and NCDs, and especially for those among us that are more vulnerable?
Thank you very much, and thank you to the government of Mexico, of Colombia, for hosting us. I'm going to Mexico next. That's why I mentioned Mexico. But as we heard today, and from all of the experts in this panel about the effects of air pollution on health, and especially on NCDs. And I can tell you, I lived in New Delhi, which is a very polluted city, for a number of years, and as an asthmatic, it was a very difficult period for me. But also at that time, when the time that I was living there in the late 90s, the Supreme Court of India made a decision to ban the use of kerosene on the rickshaws and the taxis. And it was like an overnight decision that the next day they all have to use compressed natural gas. And within a few weeks, we saw a significant change in the quality of air in the city. So you don't have to lock down people. You don't have to block streets to change. I think that what we learn from examples like this is that with policy, we can change significantly the current situation. But there has to be a political will, or in this case, a judicial decision that compel that action. But throughout, throughout the world, we see cities that are increasingly more polluted and more congested, and also an increase in the number of people suffering from non-communicable diseases. In my area, especially in asthma and chronic obstructive pulmonary disease, is especially difficult for patients to live with these conditions in places with poor air quality. It's already difficult to breathe and to manage these conditions in an area where the air quality is good. Imagine where that isn't the case. But I think that also we see excellent examples. I mentioned of interventions that can be taken from the government, introducing stricter regulations on the emissions of vehicles and factories. Like, for example, the situation in Mexico City, where the introduction of Hoy No Circula is a policy limiting the car usage based on the license plate numbers. And this has led to improved air quality, benefiting those with respiratory illnesses. Also empowering communities. I think local training on recognizing pollution symptoms and how to seek medical help can empower communities, particularly in countries like Kenya, where the access to healthcare varies, and the public awareness campaigns that these communities carry out also encourage many people to be vigilant about their health and their surroundings. Using technology like mobile applications that provide real-time air quality data can help individuals living with NCDs make informed decisions about their activities. For example, in Brazil, the apps like Cidades Resilientes provide essential data that helps users avoid outdoor activities when the air quality is poor. I was listening to the colleague from the Gambia about the installation of units to monitor air quality. Having good quality data of what is happening allows governments and allows cities to make decisions to alert the population and to intervene to help them. But I think all of these things that I mentioned require, number one, the political will, require the collaboration of all the sectors involved. It's not just the the health department or the ministry or the government. I think it requires all of the different sectors. And most importantly, I think it requires the human part of it. Remember that it's not numbers. These are people. This is somebody's son, this is somebody's daughter, somebody's mother that is dying. When we say these statistics, there are human beings behind, lives that are affected, households that are affected, communities and nations.
Thank you very much. Katie, if I can come to you next. We've sort of heard about respiratory, cardiovascular, and some of the other impacts. But one thing we have not talked about as much is other diseases, including diabetes, chronic kidney disease, and some of the other less well-known diseases that are also linked with air pollution. Can you speak to that a little bit and give us some more insights into that?
Sure, happy to. I mean, I think as other speakers have emphasized so far, I mean, obviously air pollution impacts the whole body and every single organ. And as a result of that, from a non-communicable disease perspective, that there's significant impacts, both, I think Mark was saying this earlier, in terms of the mortality, but also really importantly in terms of morbidity as well. And we shouldn't forget the morbidity aspect as well. The NCD agenda has very much focused on premature mortality as the kind of main target. And I think at some extent, almost left the morbidity aspect to a side. But going to your question about kind of the different impacts beyond lungs that we've talked about a lot, we've talked about the cardiovascular impact. I mean, just to share a few statistics, I mean, air pollution causes about 20% of deaths from diabetes, so type 2 diabetes specifically. We all know very well the kind of links between air pollution and lung cancer. 29% of all lung cancer deaths can be attributed to air pollution. But there's also other cancers that air pollution is impacting on. For example, brain, liver, cervical, ovarian, you name it. It's essentially kind of connected to so many different parts of the NCD agenda. And you mentioned kidney disease. I mean, air pollution is now being seen as increasing the risk of kidney disease-related events, which obviously result in hugely kind of expensive complications, which are obviously draining health budgets around the world. And then our colleague earlier was really emphasizing the links between brain health. So obviously Alzheimer's disease, Parkinson's disease, really affecting brain health as well as the mental health impact that Ale was pointing to. So that there are so many connections. I mean, and air pollution is almost like the pin that connects so many of these different diseases that we at the NCD Alliance really focus on.
Thank you very much. And Janet, I'm going to ask you a question, and I will already apologize for my Spanish. Pero, ¿cuáles son las necesidades de información?
What are the needs of information on non-communicable diseases and the quality of air? How the participants on this conference could support governments in this situation?
Sí, creo que justo es muy importante porque se han detonado acciones que, como lo comentaban aquí hace un momento, desde el 2016 en México existe ya como esta vigilancia epidemiológica en esta Ciudad de México. Y justo en la Ciudad de México, que es la gran cantidad de población, que lo acaban de comentar, gracias a esta información que se empezó a vertir, se hicieron cambios y ajustes en políticas desde el ámbito ambiental, pero también de regulación, como bien lo comentan. Y sacamos normativas también, que incluso hay una norma oficial de calidad del aire y salud. Esto nos indica, o nos da un índice, ¿no?
Index. Good, the quality, and what are the effects that we are expecting? And this is an application where the population can have access in real time. Every hour they are updating the quality of air, and this allows knowing the population through social network that are generated, which is the communication of the risk and knowing what is it that they are breathing. And also what is missing on the part of economy. With the colleagues, we said when there is going to be a new product, such a vehicle, such an air conditioner, or a new stove at home, you are going to call me for me to tell you what is going to happen if this does not meet the regulations in health, what the cost is going to be. So this evidences that we leave to other sectors, not only for us in the realm of health, we finally are going to ensure medication diagnosis, the treatment, but if we do not tackle the origin of this situation, we are not going to be able to do anything. In Mexico, what we pretend with this approach is saying, well, there is a halfway evidence now from the federal realm that should assume the government on the part of health. You can, with this, demand for actions. This is what I could share with you. Thank you.
Been other NCD risk factors which have seen success. We've seen a lot of work happen and trends move in the right direction in case of tobacco, for instance. And as we think about raising the profile of air pollution within the NCD community, but also taking action, are there lessons that we can learn from the tobacco experience that would be applicable here?
Sure, and as I see many colleagues here also who work in tobacco control, and tobacco is one of the most significant contributors to NCD, and we've learned a lot about taking action against it over the years. Let's take those lessons, and starting, for example, the advocacy that led to the adoption of the World Health Organization's Framework Convention for Tobacco Control, which is today the only treaty in the world for health. And this policy has made a huge difference, for countries to address the issue of tobacco control. The Empower strategy that the WHO used to implement the FCTs has, over the past 17 or 18 years, helped in bringing concrete action to be implemented in the countries to create spaces free of smoke, to increase taxes, to ban advertising, labeling, etc. So there's the policy framework, which is very important. But I think what we learn from there is the global collaboration that exists in tobacco control. I think that there is the FCTC, and then there's the network of cities and countries that are working to implement this, and as well as the advocates and the institutions that are behind. Countries have taken big steps. I'll mention some. There are like many, but I go back to Brazil, which implemented some of the world's toughest anti-tobacco laws. I think Paula Jones here, who is from there, and banning public smoking and requiring graphic warning levels on cigarette packaging. These actions remind us that what can happen when there's a strong government and public support for a particular policy, and it can rally the support for clean air initiatives that we can use to save countless lives. Education and advocacy in Kenya, for example, the Tobacco-Free Kenya has focused on education and educating people about the dangers of smoking. In the community-based approach can be applied to raising awareness about the health risks associated with air pollution. There's also community mobilization in India, grassroots movements that have successfully campaigned against tobacco use in public places, especially banning, for example, tobacco near schools in the sale of tobacco near schools in New Delhi. But I think that there's also another important factor, and that is that we have learned that by taxing tobacco, we've not only reduced contributed to reducing the consumption of tobacco, but we're also collecting funds that can be used to address some of the harms that this product causes. And there have been good models, like for example in the Philippines, the sin tax that was developed, and Thailand is another country where has used tobacco taxation and invested that into a health fund. And this has demonstrated that it's an effective policy tool that can be also applied to air pollution taxing that contribute to polluting the air and allowing also the government to collect funds to address the damage that it is causing in the population.
Thank you. Some good thoughts there for us to deliberate on. Katie, you mentioned in the plenary in the morning that despite the addition of air pollution as a risk factor within the NCD framework, there hasn't been a lot of work to bring that up or integration. You also mentioned that it takes time for policy frameworks to truly reflect those types of decisions. So from your standpoint, what are things that are needed to create better awareness about integration of air pollution and consideration of air pollution as a risk factor for NCDs, but also from the side of the governments, what might be needed in order to make this process a little bit faster than what it has been so far?
Thanks for the question. And maybe just adding to what Jose was saying about the kind of lessons between tobacco and air pollution, I think another one would be perhaps the fact that with air pollution, with tobacco, with alcohol, with unhealthy diets, we have very powerful industries that we're working up against. And in tobacco, the same with alcohol, unhealthy diets in the NCD space, I think we've learned a lot in terms of the playbook of those industries. And the fossil fuel industry is using exactly the same playbook as tobacco, as alcohol, in terms of confusing the evidence, setting up front groups to do the advocacy work, interfering in public health policy. We see it time and time again, and I think coming together between the environment and climate advocates with the NCD advocates in terms of the push against the industry is another kind of really interesting area that I think we could be doing so much more in this space. Going to your question, so in terms of the awareness, the kind of links between air pollution and NCDs, I was touching upon this this morning in the plenary. I mean, I think I mentioned the fact that air pollution came into the NCD policy response, as it were, 7 years ago, 2018, same time as when the first WHO conference on air pollution and health was also being organised, right? And I think there's obviously, clearly still some work to be done in terms of really integrating air pollution into the global and national NCD policy response. And I think there's many reasons for that. I mean, for many, many decades, the NCD response had focused on what we call the 4x4, the big 4 diseases together with the 4 risk factors. 2018, we added air pollution in as the 5th risk factor, added in mental health as the 5th disease and condition that was focused on. And as I said, I think it takes time for those to really be embedded and integrated. And let me share a couple of examples where I'm seeing at least the slight disconnect in terms of air pollution. For example, WHO globally on the NCD policy response has a global NCD strategy on NCDs, has a set of global targets that all governments agreed to back in 2012, and also have a set of what we call our best buys in terms of our cost-effective interventions that we know work in terms of preventing these diseases and treating them. At the moment, air pollution is really not well integrated into any of those 3. And I think this year is a really important moment to change that because, number one, all governments are going to be reviewing that global monitoring framework and the set of targets that were agreed back in 2012. Great opportunity to really integrate air pollution into that, I would say. Secondly, in terms of the best buys, I know there's work ongoing in WHO to develop a specific set of best buys for air pollution. And the reason why I say that and why I think that's helpful is the way that we have found those best buys in the NCD response over the years helpful is that it gives you a menu of options to go to governments and say, these are the interventions that have really strong data around the return on investment, going to the point about the economic arguments are as important as the epidemiological arguments and data. So we have the economic data that there's actually a return on investment on these interventions. It's not just a cost. And we know they work from a public health perspective. So having those best buys in air pollution and integrating it into the broader NCD best buys, I think would be really helpful. I talked earlier a little bit about the fact that there's still the disconnect at the country level, and that's obviously the most important part of all this. National policy, where the rubber hits the road in terms of everything. And until we're seeing air pollution really included in national level, national NCD plans and targets, and the air pollution community included in the national coordination mechanisms that are taking place at country level, there's going to continue to be that disconnect. And I think with all of this, we all know that we can push and push and push at the political level to bring our governments on board. We always need to bring the general public with us in terms of bringing their attitudes in line, and for them to be pushing politicians as well. So we absolutely need to make sure that we've got the general public on our side in terms of air pollution. I think awareness has significantly changed over the last 7 years in terms of the impact that air pollution is having on health and on communities. And I think other specific ways of increasing awareness amongst the general public have been mentioned. Jose talked about educational campaigns, mass media campaigns in tobacco control have changed things so much, and the same for alcohol and unhealthy diets. Mass media campaigns at the country level around air pollution and the risks around health and the effects of health can be extremely powerful, as well as data. And our colleague from Mexico has really highlighted the fact that unless you've got strong data, as well as Mark earlier, strong data, surveillance systems on air pollution, the effects on health, it's very, very hard to take that to your governments unless you've got that strong data. So I think having all of that in terms of constant push at the political level, using the high-level meeting on NCDs and mental health this year as a real opportunity to bring air pollution front and center of the agenda, and then continuing to work with health professionals and the general public to keep building that demand for urgent action on these issues.
Thank you very much. We have a few more minutes to go, and you've been very patient with us. So if anyone has questions, either for the panel here or for any of the speakers that you heard from before, now is the moment. Okay, we see a question there. So I'll bring a mic along. I see 3 hands up already, so we'll maybe take 4 questions just so we can close the session in time.
Hi, I'm Diego Fano, PhD student in epidemiology at the Universidad Peruana Cayetano Heredia. And well, this question is for all the speakers of this session. So when thinking about causation, I think, well, we can mostly agree that for infectious or vector-borne diseases is more straightforward, right? Because, well, no, if the bug is not present, then the disease is also not present. But for NCDs, it's much more complex. Okay, so how important is it to determine a causation framework for each NCD prevention? And by determining the cause, I don't mean as a sole cause, which for NCDs, I think it's impossible, but as perhaps a causal model as those developed by Professor Rodman some decades ago? Or is it enough to know the risk factors, attributable risk, attributable death, and so on?
Please.
Congratulations for your Spanish. It's amazing, by the way. Mi pregunta es para...
My question is for Janet. I'm so pleased to see you in this conference. I'm Selene from the civil society organization called Observatory Air Quality from Monterrey, Mexico. My question is, how can we as civil society support for the states of Mexico, particularly Nuevo León, from where we are, can join to this effort of the surveillance system of health, basically? How can we join you?
Thank you to the panelists that have spoken so far. My name is Waziri Mina Sarah. I represent Urban Beta. I came from Lagos, Nigeria, and we are huge on advocacy. From our work, we have discovered that a lot of people that use biomass fuel want to use clean cooking stoves. It's because it's not affordable and accessible. We keep talking about clean cooking stoves. And the things I'm seeing here is electric cooker or maybe gas cooker. But if you give them cylinder, they still have to fill it. My question here is for everyone. Is there really an affordable and accessible solution? That is my question, because it's been a problem. Thank you.
Buenas tardes.
Good afternoon. Thank you so much for your interventions. Katia, I would like to ask you, I represent the international movement Social Alatra. We are volunteers from 180 countries that research about climate change. We investigate about it. We know there's a relationship between hot climate and the ocean, micro and nanoplastics. And I would like to know if you can talk with me, you can tell us what are you doing with the pollution of nanoplastic, not only for the ocean, but air, and what it has been found in all the human body. And I also want to tell you that you can investigate and you can look more about the technology that the water atmospheric and GGC as a solution to this problem. Thank you so much.
Janet, can we start with the question for you first?
Yes, thank you. And what we are doing right now in this second stage of building this surveillance system is that we are going to visit the 10 states. To do this same roundtable, we are going to put it on each state. It needs to operate, it needs to work from the national to the local, creating awareness of all the authorities, high-level authorities, and then with the one that's going to operate. The physician, first level physician, needs to prescribe clean air, needs to acknowledge the diseases that we are talking here today in different stages. Because this is the surveillance that we are facing. There are acute effects short term, there are effects medium term, and there are effects on a long term. Cancer, for example, as you were saying before, chronic renal diseases, which are systems. Be careful, they are already there in the surveillance system for diabetes, cardiac, renal, which is also an approach that it's not easy, it's not simple because what it implies. But at least in Mexico, we have these two systems that are working at the same time. They are being built. Renal and neoplasms that are going to provide the other vision about chronicity. So we need to address this topic and issues of air with their immediate effects and on a long term. And we need to make a traceability to identify of what I have been able to identify. So you are more than welcome. That's the thing. We need to identify who needs to be in the table. We need to add more people. Thank you.
And the attribution question.
Yeah, so I think this was the first question that was really addressing the causality. So we see all these different associations between health and various different air pollutants. How much do we need to know about the underlying biology to be able to take action? And I think we know more than enough already. Certainly, I've been working for 20 years on the biological mechanisms for cardiovascular disease, but even with kidney disease, brain health, mental health, we actually know a huge amount about the mechanisms. So I think we can take action without that. I don't know if people attended Francesco Forestier's talk this morning where he showed data from the US EPAs which are very, very detailed, and they tell you which are likely to be the causal mechanisms, which are suggestive. This is all to do with the uncertainty of evidence. So there are gaps in the knowledge, and we need more research. But there's more than enough, I think, now to show, these are the health effects. They are clear. We know why they're happening. We know which air pollutants are most likely to be causing them. We need to be moving on to the action.
Would any of the other panelists?
Thank you. I completely agree with Mark, and it's a great question. When we think about causality in different forms in biology, I think it depends on the discipline you talk to. I once was talking to an epidemiologist colleague, and I said, "Oh, so you say it causes?" And she almost had a heart attack because she said, "We never say causal. We always say correlation." But in my case, when we work, one of the ways we study is we really get cells from humans. We work with animal models and try to, when there you can really test, okay, in a very controlled environment, certain pollutants, certain chemicals, and be able to assess the mechanisms. I know, but again, it's really hard to reflect on it in the real life, because in real life we don't know exactly what kind of materials are in the PM 2.5s. We don't know. There's also other compounding factors. Air pollution usually comes with either extreme weather events or it can come with heat. And these effects, we don't know at different organs what kind of effects they have. And I completely agree with Mark. I think we have enough evidence. We'll continue as scientists, continue gathering more evidence. But while we're doing that, let's move on to action. Let's not wait for those evidences. And I think I had my colleague taught, I think you asked about nanoplastics, microplastic. My Spanish is not, okay. I will be speaking in English. I'm sorry, my Spanish is really not that good, but we have growing evidence. We know, at least in the brain, that nanoparticles can pass blood-brain barrier and go directly into the brain. There are certain studies now show that there's as big as a spoonful of microplastics in our brains. We see it in every other organs, including human sperms and semen. It's everywhere. And I think we're just starting to understand what it's doing to our bodies. There's a lot more to be done. But again, like Mark said, we'll work on the evidence, but let's get on the actions on how we can limit plastic waste and plastic usage, because it's going to be a big determinant of our health as well.
Thank you, Burchan. And also, if any of you are interested in more on microplastics, Professor Frank Kelly is here at the conference and has done a lot of work on that topic. So try and find him so you can learn more. Katie and Jose, I'll come back to you with the large question in the room, which Waziri asked, which is, do we have a scalable solution to address the household air pollution problem? We got a strong testimony this morning also about the need to address that issue, and there are significant economic barriers to it, but where can we look to make progress on that?
I have to admit, it's not my kind of area of expertise. I'm sure there's many other people in this room that could do a much better job of answering it. I don't know if, Jose, you've got...
Not either, but there was someone here who just stepped out of the room who's an expert, and there may be others in the room who know more about cook stuff.
Yeah, maybe, Waziri, my suggestion is going to be, there's a couple of excellent household air pollution sessions. All the right people are there. There's also Professor Balakrishnan in the room in the back. She's the person you want to talk to if you're in this room. But it is a really great question, and hopefully you'll get some answers in those sessions.
Sumi Mehta, who was sitting right behind you, also is an expert on this.
Well, thank you, everyone. This has been really excellent. Thanks a lot to our speakers and panelists for taking the time to be here, and for all of you for joining us. We're going to continue the conversation. Hopefully, you got some ideas and thoughts, and we'll see you at the next event. Thank you very much. Have a good evening.